President Obama said during his campaign that change comes to Washington, not from Washington. Again, I repeat, change comes to Washington, not from Washington. And today in this room are 150 people who have left their families and jobs to come to Washington from 34 states to make a change.
I work for a company called Sodexo. I've been there for 10 years. If I get the insurance for my job, that means I wouldn't be able to pay my rent.
And what we want to try to accomplish is to ensure that all Americans have access to quality, affordable health care, and no one will ever be forced to go broke just because they got sick.
I'm in this fight because my brother wasn't insured, and actually he had a pre-existing condition, and that's why they denied him insurance. But when he needed a life-saving surgery for his heart to keep beating, that was denied him because he was uninsured. Now, he died March the 7th, 2009 at the age of 57. I was fighting for health care before that, but I got real strong at fighting for health care.
The thing that scares me the most is the random person in an icy intersection that might come by and hit me without me being to react or anything like that. And so any kind of large bills, any kind of medical procedures, I wouldn't be able to afford.
It's hard to live so close, not knowing when is it going to be the next thing that I just can't afford. If my premium goes up again that much next year, or even a little bit, I have to drop health insurance.
My son is 5 years old now, and since he was 2 weeks old, he's been catching seizures, and not one of these doctors could tell me where it's coming from. I can't take my son to a specialist, which I want to take him to in Connecticut, where they specialize in just seizures, so they could tell me what's the problem. And it hurts me because I have to listen to what my son tells me practically every other day. Mommy, why am I sick? Do I still have to take this medicine? My son has been on medicine since 2 weeks old. And it hurts me to tell him, listen, you have to take your medicine today, when he's tired of it already. But I know if they was to pass this bill, it would make it a lot easier, because then they could find where these seizures are coming from and they could take them off some of these medications.
As we think about Reverend Martin Luther King, whose birthday we will celebrate on Monday, there must have been moments in his struggle where he wanted to sit down and say, maybe I should settle for something a little less. And we're here today to help our champions stay strong.
We need you, my friends, to take us home. Take us home on health care.